further ado, Representative Abercrombie, if you'd like to introduce yourself.
Sure. Good morning, everyone, and let me just say thank you for inviting me to be part of this panel. I represent the 83rd District, which is here in Meriden and part of Berlin. I am the House Chairwoman of Human Services, and I'm also on Appropriations, and I do the Subcommittee for Human Services, which means I do the budget for DSS, DCF, DMIS, DDS, DOORS, and a few other that fall under Human Services. And I'm happy to be here today.
Good morning. Thank you for holding this educational event for us. My name is Mary Morgan. I am a pharmacist. I am the dispensary manager at Willow Brook Wellness. We're a medical marijuana dispensary here in Meriden. We opened last April up on East Main Street. I'm probably going to talk for more than 2 minutes.
Go ahead.
I'm used to having hours. We just opened here in April. Prior to this store, I managed another dispensary here in Connecticut since 2014, so I've been in this industry since its beginning. Willow Brook opened here in April. We're all pharmacists and pharmacy technicians that work there. This program in the state of Connecticut was essentially designed after the traditional pharmacy model. You have to have a pharmacist overseeing the dispensary at all times. All of our employees at this point are pharmacy technicians. They've all come from traditional pharmacy. We've all worked the bench. They know HIPAA laws, they know drug utilization review, they know traditional medications as well as all the new products available. In Connecticut, the marijuana, having a marijuana certificate or having a card for marijuana really starts with the patient and the doctor. It doesn't start with us. You can't come to me as you would to pick up ibuprofen or Advil or something like that. It starts with a conversation between a patient and doctor, whether the doctor starts the conversation or the patient does. There has to be a conversation, is this an appropriate therapy for me? Do I qualify for the program? Do I have a disease state that's on the state approved list that gets me into the program? And even if I do, is this appropriate therapy for me? The doctor and patient usually talk about the risks and benefits of it, what their expectations are. If they all agree, if all the numbers line up, the doctor can go on the state website and certify the patient. They don't write a prescription which is brought to the pharmacy. They actually go certify the patient on the state website. The patient then has to provide the state with some information. They have to prove who they are with a picture ID, driver's license, passport or something. They have to prove that they're a Connecticut state resident, and they have to pay a fee to the state to get the card. The cards are good for 1 year. That 1 year starts at the doctor's visit, not when they actually receive the card, because that sometimes takes another month. So once they get their card, they would then schedule an appointment to come into the dispensary. You have to choose just one dispensary. You can't go to CVS, Walgreens. You can't go to any of the 14 now open dispensaries. You choose one. You're essentially locked in. They can change during the year, but you choose one place for treatment. They come in and they make an appointment, and we usually sit down. I usually meet with a patient for the first time, and it's about an hour. There's a lengthy amount of paperwork that they fill out, just like when you go into a doctor's office. And we get a complete medical history on the patient. We get a medication review. We do actually a drug utilization review. We look at their medications. We're looking for drug side effects, things that are going to interact with the medication that we're using. We talk about their expectations. What are their history with marijuana? Do they have any tolerance? Have they ever used it before? Are they currently using it? Where are they getting it? And then we give them a lot of education about the product, about the producers, about all the dosage forms. There's a big interaction between us and the patients to figure out what's going to be working for them. When they leave, it's an individualized treatment plan. Nobody leaves with exactly the same amount of medications. We make selections based on their lifestyle, based on what their wants and needs are, and they leave with a bag of medication. There's probably 300 items available in my vault that we can choose from. Just because a patient wants something doesn't mean that that's best for them. We sometimes have to remind them that it's here as medicine. This is not best for you. We're going to choose something else, or we're going to start you off very slow and gradually increase and change your dose. So they might start with maybe a week's worth of medication and come back and check with us. Did it work? Did it not work? Did you have side effects? That kind of thing. It's very, very individualized. We look at it as another tool for practitioners that they have in their toolbox. It doesn't necessarily replace all their medications. It might be an additional therapy, or it might be an alternative therapy, but it really starts with the doctor's office, and then we take it over after it's been all certified. Kind of gives you an overview.
Mary did not bring samples.
I brought my box. I have the. I actually do have samples, but it's all placebo.
It's not real.
Everything in that box is not real, but it shows you a wealth of all the different dosage forms. It's not just smoked flour. You want me to keep talking?
Go ahead.
There's 4 dosage forms really available in Connecticut to get the medication to your body. There's the transdermal dosage form, creams, ointments, bath salts, things that you would apply to your skin. There's ingested oral forms, so tablets, capsules, edible products, oils that you would mix into food or ingest. Those are usually very slow acting. They take a long time. Duration of action is 6 to 8 hours sometimes. There's inhaled dosage forms, there is dried flour, there's pre-rolled joints, there's vape pens, disposable and reusable vape pens. Those are really quick acting. They work in 30 to 90 seconds. They might last about 3 hours. And then we have sublingual and buccal products. Sublingual is under your tongue, buccal is when you put something in your cheek. They have a little bit different onset of action, anywhere between 10 and 30 minutes, and they might last 4 hours. A big selection of products, because if you were in a movie theater and you either have extreme back pain or maybe you see something on the screen that's triggering your PTSD, you can't smoke a joint in the movie theater, but you could take a little bottle of spray out of your purse and spray it under your tongue. It's very subtle, it's very discreet, nobody knows what you're doing. There's lots of different dosage forms, so we have to kind of match the patient's needs with an appropriate form for their lifestyle. And each of those products is probably available in 5 or 6 different selections, whether it's sativa only, indica only, THC only, CBD only. So there's a huge menu which we have to navigate for the patients, because most patients couldn't understand what's on it. So, sorry.
No, that's really helpful. Absolutely. Good morning, everyone. I'm Pam Thornton, and I'm the Director of HR Services at the Employers Association of the Northeast. And we are a not-for-profit membership association for employers that need help with HR. So consulting services, certainly, and then we also have a whole arm of learning and development. So we not only help answer questions, help manage big projects, small projects, we help train you on some of the things that you need to be prepared for, like how do we deal with medical marijuana in our workplace when we can't smell it, right? So a whole host of different things. What I'll say is that we've been around for 100 years. We have an office here in Wallingford, Connecticut. We have 30 people on our internal staff that are HR experts that deliver on-site service, but also we have a hotline where one of our benefits to our employers is that you can call with a problem or a situation. Or, hey, this new law just came out, how do we apply it? And reach out to someone who is an expert, subject matter expert in that area, and can help you with those kinds of things. So I think one of the reasons I'm here today is to certainly help us all understand how we deal with this in the workplace. I'll tell you that, I may not have all the answers. There's lots of strict requirements here in Connecticut about how we deal with this. But happy to be here. Thanks so much for having me, and look forward to our conversation.
Thank you. I'm Craig Allen. I am a child and adolescent psychiatrist and a general psychiatrist, adult psychiatrist, and an addiction medicine doctor. I'm the medical director for Rushford, which is behavioral health and substance use treatment program here in central Connecticut. I'm the chief of psychiatry at Midstate Medical Center, the vice president of addiction services for Harvard Healthcare. I'm on the opioid task force and the addiction subcommittee for the Connecticut State Medical Society, and the president of the Connecticut chapter of the American Society of Addiction Medicine. I'm here today to try and help to clarify, level set around medical marijuana, which I will begin doing right now. To prescribe a medication is something you do with a substance that has been FDA approved, and doctors are trained to prescribe medications that have been studied in placebo-controlled, crossover, double-blind studies to show efficacy for specific symptoms related to different types of medical disorders. There's a dose, there's a duration of treatment, there is an expected outcome, there are potential side effects, there are potential drug interactions, and this is how we are trained in medical school and beyond to use medications and other therapeutic interventions and tools. Medical marijuana is different than that. There are not prescriptions written because none of the items that are at the dispensary are FDA approved, meaning they do not have the evidence or the study done to show efficacy the same way that FDA-approved medications are studied. To be able to prescribe a medication, you go to medical school and you learn about these drug interactions and you learn about these medications. Sometimes people use FDA-approved medications off-label. That means this medication has been studied for use with adults to treat depression. I have a child patient. I've used the medications that are FDA approved for that child patient. I have used different types of therapies. I need to go the next step, and so I'm going to explain to the patient and the family that I am using this other antidepressant medication that's only approved for adults with their child if they agree, and here's what we should look out for side effects, et cetera, et cetera, et cetera. When a substance is certified, when medical marijuana is certified, that means that the patient has gone to the doctor's office. They've had a conversation, whether initiated by the patient asking for medical marijuana or potentially by the doctor. The doctor will say, I think, and by state law, the doctor has to say, I think that there is a medical marijuana product that would benefit your chronic disease state, and it is better than what is available currently, FDA approved, etc. And the benefits outweigh the risks. Now, where does this doctor learn about that? 9% of the medical schools, currently, 9% of the medical schools have cannabinoids and cannabis in their curriculum. So that's currently. There's been a big uptick with the legalization of marijuana in different places across the country. 9% is a very, very small amount of medical schools, and that doesn't say what the curriculum might be. To be allowed to certify medical marijuana in the state of Connecticut, the doctor must go to the website, sign up, and then they can do that. There's no training. There's no need to be certified in being able to identify high-risk populations, such as someone who has an addictive disorder, or someone who has a psychiatric disorder, or someone who is under the age of 24 when their brain is fully formed and they're less vulnerable to developing a substance use disorder. There's no certification for training in knowing how to use cannabinoids for a different type of disorder. Do you use CBD, a high percentage of CBD versus THC? Do you use an entourage preparation? You do not have to show any understanding of cannabinoids, cannabis, interactions, efficacy, route of administration. You simply need to say that this patient in front of you has one of the, now I believe there are 30 different indications from the state of Connecticut for medical marijuana. You say your patient has one of these indications, and you say you think that your patient will do better on this than something else, and the benefits outweigh the risks. Again, how you're basing that decision can be widely variable, and there are doctors in the state who know a lot about cannabis and cannabinoids who write these certifications, and there are doctors within Hartford Healthcare. Andrew Solner, who is an oncologist, treats cancers. He will use medical marijuana products with some of his patients to manage pain. Jonathan Cost is another doctor in the pain group at Hartford Healthcare, and there are certain patients that he will recommend medical marijuana for. And when they make recommendations, they make specific recommendations based upon the literature and their own clinical experience. And having that opportunity for them is great. And they use their medical expertise to make those recommendations. But the evidence for medical marijuana for the vast majority of conditions, and there's 50 across the country, 50 different conditions that are listed in different states. The evidence to treat the symptoms of those conditions is lacking. It's really not there, except for probably 3 or 4 conditions, such as some types of pain, some types of rare refractory infantile seizures, side effects of chemotherapy for cancer, appetite loss in people that have chronic disease such as AIDS, some strong evidence around spasticity with multiple sclerosis, although not totally clear. Patients report more benefit than the doctors are able to verify with those studies that have been done. That's about it. That doesn't mean that there isn't a role for cannabinoids or cannabis in treating symptoms of some of these other disorders. But we really don't have the evidence to show that. And we do know, and we do have evidence about the potential harms of marijuana and of cannabis in the general population, but particular concern of mine are the 3 highest risk populations, and those are people without fully developed brains because they are under the age of 24 if they're male, and maybe under the age of 22, 21 if they're female, people who have an existing substance use disorder or who have had a substance use disorder or have a family history of a substance use disorder, and people who have psychiatric disorders. Those are 3 very high-risk groups if they are exposed to marijuana. And I'm not just talking about medical marijuana, but I'm talking about marijuana illicitly obtained, etc. I'm going to stop, not because I can't keep talking. I can, and Mary can keep talking, but I will stop.
Thank you. Thank you.
For now.
Yeah. We encourage it. We have a very passionate group up here. So you did mention a couple of things, and I'm going to turn this to Mary for a minute. You mentioned some of the acronyms that we talk about: THC, CBD, cannabis. Mary, can you define some of those and tell everybody what they are so that everybody knows?
In a marijuana or a cannabis plant, there are about 200 active ingredients, cannabinoids. And 2 of the most active or most talked about, most researched, are THC and CBD. THC we've known about for hundreds and hundreds of years. Everyone knows that. That's the one that makes you high, stoned, euphoric, intoxicated. CBD's been more recently started to be investigated the last 20, 30 years. Cannabidiol is not intoxicating to the degree that CBD is. It doesn't make you as impaired, slightly if at all, mostly none. Cannabidiol is more for inflammation, muscle spasms, helps for anxiety, can do certain kinds of pain, not all pain. But those are just 2 of the 200. That's plain delta-9 THC. It started in THCA, which the acid form chemically changes to THC, and then we heat it again, it changed to CBN. There's lots of acronyms. All these different ingredients that we have to navigate. There's terpenes. Terpenes are chemical compounds found in nature. They're found in most things that have a nice odor or flavor. They give odor or flavor and they have medicinal values. So we have to look at the terpene profile of a particular strain of marijuana because the terpenes affect how the THC is metabolized in your brain. It actually has medicinal value itself, whether it's helping to put you to sleep, or maybe wake you up a little bit. There's, for instance, a terpene called alpha-pinene and beta-pinene, also found in pine trees. When you smell marijuana that has a lot of alpha or beta-pinene in it, it smells like pitch or sap. And it tends to be very awake, alert feeling. It can be sometimes as a bronchodilator, people will go into a pine forest and say, "It smells so good in here, I breathe better." Because you do. Because the pine trees are giving off pinene and it's opening up and making you feel like you breathe better. It totally does. So we have to navigate all these things. In general, THC and CBD, CBN to some degree are the ones that we're really looking at. But there's much more to picking out a product than just chasing THC or just chasing CBD isolate. We're looking at all the ingredients in the product.
So what would show up, from an employer perspective, what shows up on a drug screen if you're taking a drug test for a job?
THC.
THC.
Yeah.
CBD will not show.
Are they testing for it?
No,
Oh, they're not testing.
not my
They're
understanding.
not testing for CBD, no,
No, they're not.
THC.
They're just THC.
Okay.
The CBD products are out there. You can buy them at the gas station, right? You can buy them at the bodega, etc. And
Don't
some
vape
of-
them.
You can.
Some of the, well, many of those, all those CBD products have some percentage of THC in them. And they're not regulated, and so some have a little bit more THC in them. Probably more popular ones might have a lot more than is listed, and that's what may show up. So, I mean, my patients might not be a great population to look at, but I have patients who tell me, I'm only using CBD, it helps me with this, that, and the other thing, and they're testing positive for THC. So, don't know exactly where to go with that.
Yeah.
If they really are using CBD, I am much, much less concerned about their risk of relapse or exacerbation of an underlying psychiatric disorder with CBD. But there is some in there, and what is tested for is the THC.
So while we're talking about drug testing, can any employer randomly drug test, or what is some of the law around that?
No, so, yeah, no, that's a great question. So, in the state of Connecticut, as I mentioned earlier, you've got very, very strict rules around drug testing. There's 4 kinds, and I'm just gonna talk about them all because you're gonna ask about them. We have what's called pre-employment drug testing, so where we wanna test someone for a panel of drugs before they come and work for us. And we can absolutely do that, but we have to have their permission, the candidate's permission, a written document that says, yes, you can go and test me before you hire me, and that has to be post-offer. So we've already made the decision, we're not basing it on any kind of discriminatory factors like them testing positive, that we want to make you an offer. So we've made you an offer, and we have decided that we are going to do a drug test. So you sign off on that. So that's called pre-employment. Then we have what's called random drug testing. And in the state of Connecticut, unless you are working for the Department of Transportation or a highly safety-sensitive type position, it is very difficult to put anybody in a random pool for drug testing. And in order to do that, you have to have a first step type of program called reasonable suspicion drug testing. Okay, so you have to have a formal program, a policy in which that you have implemented, communicated to your staff, all of your employees, that says, if there is a reasonable suspicion, if I have a reasonable suspicion that you may be impaired, this could be anything, marijuana or whatever, then I have the right to send you for a drug test. Very difficult, right, to measure impairment. So we have training for our people that are ones that are identified, who are the ones who are gonna say, we've got somebody who potentially is impaired. How do we measure impairment without drug testing? And sometimes, how do we even know with things like marijuana that that's the reason that they're impaired? Because there's really nothing that says, you have this amount in your system, this causes this. There's really challenges around that. So again, in order to have random drug testing, it has to be something that is through the Department of, you have to be working for the Department of Transportation, and that is because federally, marijuana is still illegal. Okay, so at any level.
Illegal.
Illegal, sorry, I'm sorry. did
No,
I
no,
say
I
illegal?
think you said it right. I just wanted to
Illegal.
emphasize that.
Right. So we have all of these states that are, several states that have medical, marijuana legal and recreational, right? So that's a whole nother thing that we potentially have to worry about down the line when it becomes legal, if it becomes legal on a recreational basis, how we're gonna deal with that. So reasonable suspicion really requires that we have people in our organization, managers, leaders that are trained on identifying impairment. It has to be corroborated by more than one person, more than two people preferably. It has to be identified in more ways than one. So not just because you smell like it, because quite frankly, we can do other things than smoke it, right? We've just learned that. So
Interestingly,
yes, right.
when someone is pulled over by the police with a suspicion of driving under the influence, they have to have specialized testing done to
Yes.
try to identify
Exactly.
whether or not this person is intoxicated from cannabis. Just because of what you say, it's
Right.
really, really hard. It's not as easy as it is with alcohol, where you do a blood alcohol test.
Yeah, there's no
And so
breathalyzer
There's
at this
special,
point, yeah.
special training. It used to be in the state of Connecticut, there was like one team who could do this. And so if you were arrested or pulled over on one side of the state, chances were by the time the team got there, you might be able
Oh, to test
to not test like you're under the influence.
of marijuana.
Marijuana, I'm talking about.
Well, but, and I would challenge, how legal is it? I mean, how defensible
Well,
is it,
That's
right?
why they have a special team that does it, so that
Right.
holds up in court.
Which is great, but I'm gonna tell you right now, I am still unaware of anybody who has a threshold test that says emphatically, this means that you are impaired. And unless they are measuring impairment in another way, because in order to measure impairment, if I'm going to measure that you are impaired, I have to know who you are and how you behave. How do I know that if I
So
haven't worked with
Godfrey
your?
Perlson at the Olin Center at the Institute of Living has been doing studies for the last couple of years looking at driver impairment with cannabis exposure.
Interesting.
And so looking at different measures that change, neurocognitive measures, motor skills, coordination issues.
So my bet is that there has potentially been some case law around this, maybe.
Oh, yes,
And
absolutely.
so that's the only thing I could say is that, so potentially that could be the reason why that's upheld in court. In the workplace, it's a whole lot
I
different.
think in the workplace, it would be
Whole lot
a
different.
much bigger challenge than
Right.
trying to identify whether someone's driving is impaired in their motor skills and so forth.
So get back to the original question, I'm sorry, I'm being lengthy on this, but I really
I'm
want-
sorry I
want-
distracted
No,
you.
that's okay, I wanna give
We
people
love
the
the passion.
framework to understand the different types of testing. So if we're going to have reasonable suspicion testing in place, we can do random testing if we are federally regulated that way, okay? Then finally, the other kind of testing is what we call post-accident. So you get in a you have an accident at work and we wanna send you for a drug test. For those of us that are in those industries that have forklift drivers, again, things like that we would potentially have accidents at work, and any kind of accident. In order to do that, again, you have to have a first step, a reasonable suspicion that that person potentially could have been impaired. You can't just automatically send them unless, I'll caveat, they are in a highly safety-sensitive position. The state of Connecticut has rules around what declares positions highly safety-sensitive. And a lot of it has to do with the tasks that they are doing rather than the job title, okay? So challenging, right? No one answer to answer your question. There's, I don't know if that answered.
That's right. I
No,
think
that was
Dr.
great.
Abbott has something to add
Oh,
here.
that was great.
So one of the, and to speaking to your point, someone who is a regular user of cannabis can have THC levels that are elevated and detectable for a month. So the acute effects may occur for less than 24 hours. So if you smoke a joint and you go to class, there's an impact on your learning, there's an impact on your memory, there can be an impact on your motor coordination. But most studies show that that's pretty much gone after this acute short period of time. But the THC level may be elevated 3 weeks later. And I've had patients who really, they stop smoking. And their levels are elevated for 5 and 6 weeks. These are very, very heavy smokers.
Sure.
But so that speaks to kind of
Absolutely.
why you can't just pull someone over and say, aha, look, THC,
Exactly,
you're busted or you've lost your job.
right, exactly, very difficult.
All right, so let's switch gears for just a second. Representative Abercrombie, we've talked about a little bit of both sides of this issue. Why don't you tell us, it is challenging, why don't you tell us what's going on in the legislature with this?
So I was elected in 2005 in a special election, so I was here when we did the medical marijuana, and I did vote for it, and I am a proponent of it, and I will tell you why. Wasn't on a personal basis, but when I first got elected, I was in the grocery store, and someone that I had known through the years came up to me, and it was obvious that she had had cancer, and she said to me, if you only do one thing in your career, vote for medical marijuana. She said, because if it wasn't for that, I would not be surviving my chemo. And for me, you know, it really hit home to have somebody take the time to come up and to talk to me about it and what it meant to them. You know, we as elected officials are elected to represent you. And sometimes it's really challenging to have both sides of the coin, right? And as elected officials, we're really not supposed to have an opinion on things. We're supposed to be representing you. So let's fast forward now to the conversation that we're having about legalizing marijuana. I'll tell you, as a mother of 3 sons, a 32-year-old, a 31-year-old, and a 29-year-old, you know, I'm old school. Marijuana is a drug. But to hear the conversation with this next generation, it's really amazing the way they look at it. And so the conversation has been going on at the Capitol around marijuana. You know that there have been bills, legislation, let me say it that way because people don't always understand what bills mean, legislation to legalize it. I think that what we did this year was it came through 3 different committees. General law oversees consumer protection. So that's where it started. And then you also have judicial, right? Because there's also that component, because it isn't legal, right? In the eyes of the federal government. And then you have environment, which is where the hemp legalization, the hemp growing comes through. So what they did was they had all the cheers get together and really try to come up with a bill that encompassed all 3 of the committees. Because the reality is legislation always starts in one committee, but most times it has to go 3 or 4 before it gets to the floor of the House, right? So for example, I chair Human Services. Some of my bills have to go through education. I do a lot of work around autism. And the components of that a lot of times has to go through education. Then there's also the financial, right? So then it has to go through appropriations. With the marijuana, right, because it would be taxed, it would have to go through finance. So all of these chairs work together on it. They also looked at what's going on around the country. You know, why reinvent the wheel when we know there's states out there that have done it? I can tell you that the proposal that we were working on this year really was very much structured around what are the effects of legalizing it, and then also how do we make sure that there's dollars put aside to help communities that we know are going to be the most impacted by us legalizing it, which is very different than what most states did. I can tell you that there weren't enough votes for it, and that's why it did not pass. I will tell you that it is something that will be coming up for the next few years, but it's like any legislation, you know, you tweak it as it goes along. You look at other states. You know, we're really looking at Massachusetts right now and where they're having some challenges. You know, and the biggest part of it is the employers, right? How do they test for it? You know, and then the other part of it is there's people in the legislature that think that it should be, the age requirement on it should be 24 to go to what you say, Dr. Allen, you know, especially with boys. Mother of sons, let me tell you, I know firsthand about the brain activity under the age of 25 and how that happens. But it's, you know, I will say that it's a struggle It's not an easy issue to try and tackle. That's why forums like this are so important, because I love to hear it from all points of view, from the employer, from, you know, the boots on the ground, the docs, and then from the dispensaries, you know, what they've done, you know, and how this has affected them through the years. I think we will continue to have the conversation, but I will say that my understanding is, if you look at other states, Connecticut has the tightest regs right now around the medical marijuana, and that's what they're looking at under legalizing if we do recreational. And I think that other states have also looked at Connecticut because we were the leader on this. So where the conversation goes from here is really up to the public, as far as reaching out to your legislators, how you feel on this topic and how you want them to vote on it. Major issues, I will tell you, and people don't believe that a lot of us do this, but we do. I do a vote tally. So anytime there's a major issue coming in, I have a folder, and anytime you call my office, I keep a list, for or against. Because I'll say it again, I'm here to represent you, and you elected me to represent you.
What do you predict? Where do you think this
Oh,
is?
I have no crystal ball. Come on. If I did, I'd be governor. I will tell you that I think the challenge is this, right? And this is the other side of the argument. Do we not legalize it and let people go across the border and then bring it back, right? We know that we've had some difficult budgets through the years, right? We know that Connecticut is a high-cost state. Should it be about the dollars? Probably not, but it's a reality, right? If we're gonna make cuts in our budgets and we have an opportunity to bring in revenue, right? Are we being irresponsible by not looking at that?
Or are we being irresponsible by doing something like that?
Exactly. No, you're absolutely right. It's both sides of that coin, right? So, right, that's right. You know, so when we go and we have to tax you, right, and people say, oh my God, you're doing it again. Well, we had an opportunity, right, to bring in revenue, and we didn't do it because the will of the people said it wasn't the right thing to do. So there's always that challenge, you know, of how it goes, and what the conversation is.
But
I will tell you,
there's
we'll
also
come
the
up.
question of, when you look at states like Colorado who have legalized and then taxed,
Yeah.
a couple of things happen. One is you have an increase in the number of people who have substance use disorders, and increased number of accidents and people who are intoxicated with cannabis, and you have to put money into the healthcare system to address that. Number two is that marijuana that's taxed becomes very expensive, and you continue to have a black market of people selling the marijuana that comes in illicitly, which is part of the argument of saying, let's make it legal, we'll get rid of all this drug dealing going on.
Yeah, you're absolutely right.
So,
I don't disagree with that.
obviously, you've heard those arguments.
These are the yeah, I mean, no, but that's the reality, right? It isn't like you just sit down and say, you know, here's the information, it's one-sided, go ahead and vote on it. There's all different points that you have to take into consideration when you make these decisions. And it's not, but the financial, I believe, has to be part of the conversation.
Makes sense. So what?
Oh, don't talk sense and legislation in the same breath.
All of this, all of it. So what part of this is covered under HIPAA? What, is there any, like, is your card covered under HIPAA? I'm sure that your diagnosis is covered under HIPAA, but what is some of the
We follow
HIPAA?
everything.
You follow everything?
Yeah,
Yep.
I would think
Yep,
so.
we have HIPAA disclosure that you're given at the first visit.
Okay.
Yep, it's completely HIPAA protected.
The prescription monitoring program where physicians, nurse practitioners, PAs in the state of Connecticut, if you are going to write a prescription for a controlled substance, you have to check the PMP when you do that to make sure that the person isn't getting another controlled substance that might be interacting with what you're giving. Originally, this was around doctor shopping with the opioid overdose epidemic, people getting opioids from a bunch of different people. The cannabis products show up on there.
I submit every 4 minutes what I've just done in business.
Really?
So, yeah, at noon, if I fill an order for you, at 12:05, he can see it on your PMP if a doctor checks. So we encourage the patients to be completely transparent with all their doctors. They think they're hiding it, and it just creates problems. You need to tell everyone because they do see it, and they should see it. It's a medication in your profile, but we submit every 4 minutes to the state.
Wow, okay, good to know. Lorraine?
Where do you get your marijuana? Where does that come from?
4 producers in the state of Connecticut.
Okay.
We think the seeds came from heaven. We don't know where because you can't transport them across state lines.
They did not come from heaven.
We're not sure where the
Sorry.
seeds came from. Colorado, California, or Amsterdam, but there are 4 producers in the state of Connecticut.
Or Mississippi.
In order to stay, could be, yeah, unlikely, but.
And they produce medical marijuana only?
Yep, it has to stay within the state lines to stay legal, because we've rescheduled it as a Schedule II narcotic here. It's a Schedule I, which makes it legal in the national forum. So it has to, everything has to stay in the state lines. I can't use a credit card because they're in Delaware. Everything has to be with the state. Bank of America won't touch us because they have banks in other states.
The federal laws.
I mean, I do have a bank, which is, most people are surprised that People Bank is here, but it's usually a small bank within the state of Connecticut. So there's 4 producers in the state of Connecticut. It's all grown indoor facilities, very, very tightly regulated. They grow to their finished product, whether that be flour or joints or an edible, and it's all batch tested. They send it to an independent lab to be tested for pesticides, mold, mildew. The cannabinoids are all listed on the label. Everything is completely transparent on the label. How much THC, how much CBD, what are the terpenes, if there's an other ingredient added, like if it's an edible, the wheat, the eggs, the flour, all those kinds of things are listed, but it all has to stay with here. There's 4 producers right now in the state of Connecticut.
So you guys are able to use a bank because it's located within the state of Connecticut, and credit cards are but credit cards, how does that work? Someone can't use a credit card.
No credit cards. The only time you can use your credit card is to pay for your card at the state. They'll accept a credit card, and a debit card is essentially an ATM transaction, but there's no credit cards at all.
Because there's these stories coming out of Colorado where the armed guards have the big truckloads full of money and stuff, and it sounds crazy.
They don't have banks.
So you don't
That's
have
a little bit of
so
an
they can't do
issue
that
for
in
me. I like
Colorado?
people to know I have a bank.
They probably could do local if they
Yeah.
can get one.
They often won't though. Their employees are often
So the bank
private
may decide
contractors.
not.
They hand their employees cash
Yeah.
and they pay their own taxes. When those dispensaries go to the state to pay their taxes, they bring a duffel bag full of cash.
Yeah.
Because it's not legal
Right.
in the eyes of the feds. Think about it, right? It's complicated.
Yeah.
I mean, I think that one of the things that you're gonna see down the road is that as more and more states do it, federal government's gonna have a responsibility to step up to the plate and to start to look at this issue, right? Right now, I think that what they're doing is leaving it in the hands of the states, even though it's considered illegal, right? Let's not make any qualms about that, but I think that they're trying to let them figure it out, and then from there, they'll, at the national level, they'll figure out what
The
they're gonna
federal
do.
government has caused a lot of these issues
Exactly.
around not knowing whether a cannabis product is helpful for these symptoms and this disorder, et cetera, because it has been so very, very difficult to do the research because of these federal laws.
Exactly.
And for a long time, the only marijuana you could use in a research project, and there were multiple layers you had to go through to even get it, was grown on a farm down in Mississippi. That's what I was saying, Mississippi.
Oh, okay,
And,
that's where that came from.
and that marijuana had the THC content of like
8 or 10.
8 or 10, whereas now, what's your typical?
Anywhere from 16 to 25, 30%, 32. We've seen an occasional 32.
And then some of these more concentrated things they get on the street anyhow, the dabs and the wax and the shatter.
80s, 90% THC in the product.
And the THC is, shown sometimes that's the medical benefit. In what I've been reading, lower percentages tend to have the medical benefit as opposed to high, but that may not pertain to everything. But the THC is what is psychoactive. The THC is what develops an addictive disorder. The THC appears to be what causes the psychotic symptoms that can lead to schizophrenia. The THC appears to be what causes the destabilization for people with bipolar disorder and might have something to do with depression, the anxiety, and the suicidal ideation, and so forth. And so the studies that have been done and the information we have comes from places like a farm down in Mississippi where the THC content was 8 to 10.
Yeah.
We don't know what happens with 90%.
Right.
So
And
we
that's
have a
why
couple-
the age is so important.
Yeah?
We have a couple of questions, Mike, you want?
What are the most significant takeaways from the states that have been at it for a while, like Colorado, that have informed your thinking on this whole issue?
This is for,
I think from the conversations that we've had at the legislature when it comes to what's going on in Colorado is that I think for me personally, and I don't wanna speak for all my colleagues, you know, there's 187 of us folks, so there's 187 people that look at issues through a different lens. But from my lens is that it's still a drug, you know, and that we need to keep that in mind, right? When we talk about legalizing it. And that's the part that I always get stuck on, you know. The argument is, you know, alcohol, right? People can look at that.
Should also be
from the
24.
I love Dr. Allen, 'cause he's so reserved over there.
I'm just quietly minding my own business.
Such a shy guy.
So I think that, you know, those are the things, that's the data that most states are looking at, is states like Colorado. You know, I think it's interesting, especially when you talk to these young people, that go to Colorado to see their friends, you know, and they come back and they're amazed about the legalization of it and what it means, you know. But I can tell you that I think they also realize that there's a danger to it. They don't want to admit it, but there's also a dangerous side to us legalizing it. So, you know, I think like I said, the conversation will continue. I think Massachusetts will be the closest that we'll be looking at this point, only because they're the first ones, you know, to really get this up and running. Because they're so big, it's easier to collect the data than it would be, say, someone like Vermont, who, you know, they've probably been doing it forever, you know, because nobody knows, right? Because of the, you know, the rural areas there. So, you know, I think collecting the data and looking at it from that lens is also important, you know, as a legislature. But I will tell you that people that believe in this, I mean, they just think the rest of us are crazy for even asking some of these conversations. In their brain, this next generation really believes that we're crazy for not doing it. It's really a no-brainer in their minds. The age, I will tell you, is a big, I think that was probably one of the, so we have caucuses on major issues, right? And it's not just a Democratic, Republican thing. Everybody has caucuses. Republicans do on issues, we do, House, Senate, the whole bit. And that was one of the biggest things that people were talking about was the age. And the funny thing was, the moms were all exactly what you said, Dr. Allen, you know, 23, 24, shouldn't be under that, you know. And then the guys, right, are like, why? So it's like, so needless to say, we as women are all like, that's why.
No offense.
So it's, exactly. Even though we have much more numbers now, the highest numbers we've ever had as women elected officials, you know, in there. It's really interesting. It goes again to what I originally said, the lens. Right, we all look at things from different sides of the coin. So I think the conversation will be to see what data we can get. I think the biggest thing right now is, you know, how do you test, right? You know, someone gets, like you said, you know, there's not a breathalyzer like we do for alcohol. So that's the thing that we're looking at. And then also employers, right? What ability do they have to do any kind of testing? I will tell you, as this goes forward and the conversations continue, Department of Labor has an attorney that goes around to businesses to explain, it's a 22-page document, that's why I didn't bring it, on the laws around employers. I can give you his name. He'd be more than happy to come and, you know, talk to some of the businesses about the laws, because you have the federal law, you've got the labor laws, you know, all of that together, trying to figure out what rights employers have. And so we have to keep that in mind at all times, especially jobs that are safety, right? Do you want a truck driver, you know, out there when something can happen?
That brings me to a question that we had discussed. So if someone has a medical card, and how long are medical cards good for? 1 year.
1 year from
Okay.
the time they saw the doctor,
And how much is it to renew that card?
$100 a year.
I mean, it's $100 a year.
For the state, they pay the doctors charge them a different fee.
Okay, oh, all right, so there's two.
And the marijuana products are not covered by insurance.
All right.
At
right.
this point.
Right.
So they can range from, was it like $40 up to however much?
Yeah, $20 to $120 per item.
Cash.
Mhm.
All right, so now.
Or debit.
Or debit, or debit.
I have a bank.
Is that right?
I don't have a full money.
Just down the street,
It's a
no.
cashier's check.
Yeah, you gotta be careful with that.
Here's my account number.
Yeah.
So, what is the responsibility, like, what does an employer know? So, say you're being hired for whatever job, maybe it's a transportation position, and you have a card, you have a medical marijuana card. You go and take that pre-employment drug test. Does the employer see that there is marijuana in the system, or does it come back as negative because they have a legal card?
No, you don't even get that far. If you're working in a driver position that's Department of Transportation federally regulated, you cannot be under the influence at all.
Alright.
However,
Have drivers though.
but, so let me, the caveat is, you're not DOT, you have a driver.
Right.
You are a business and you deliver things, and
No,
you're
we transport people.
okay, you transport people,
Yeah.
things, right, people.
Yeah.
So you're transporting people, you have drivers, so, you know, but they don't fall under the federally regulated Department of Transportation.
Right.
Would that be considered a highly safety-sensitive position?
Yes.
Most of us would say yes, right? And I'm gonna tell you that if you follow the guidelines that are laid out, it's very likely that it is. So, we would be looking at potential things like pre-employment, random potentially, reasonable suspicion, absolutely, post-accident, probably. And so, what you're saying is if they've applied for the position, they produce the card, either before or after the test, we'd have to talk about it. Now we have something that's called potential reasonable accommodation under the American with Disabilities Act, ADA.
So the medical
What
review officer wouldn't just at that point, if there is they find the THC, go through the same process as they would if it tested for any of the others that are on the panel and contact the donor and say, look, you had something in there, can you produce a prescription, a card, or whatever?
They would absolutely do that, but then it's gonna be the responsibility of the employer to say, can Pam come work for me and drive my people around? What does the job description say? What are the essential functions of that job? Is it just driving people around? And if it is, you know, do we feel comfortable? Is this a safety risk? So we have the opportunity to engage in what's called the interactive discussion with the person, with the candidate, with the employee, whoever it may be, because this happens at all stages of the life cycle, right, of the employment, and talk about, we've got a safety concern here. I think that we've got case law around this, a lot of it, that any candidate would be able to engage in the discussion around it, and we, as an employer, could stand up and say, no, it's a safety risk. We have to make that stand. It's not, there's really no reasonable accommodation for me to make for someone who uses medical marijuana, who legally uses medical marijuana with a card, because I have no way to test your level of impairment.
So that's, I understand that and follow that, but I'm thinking more from the standpoint of as the employer whose blinds are on, and
Okay.
that is a HIPAA protected card that person carries, so they're not required to disclose that to you, the employer, right?
If they are using medical marijuana,
Yeah.
If it's not medical marijuana and they're testing positive, it's against the law. and
exactly.
probably not gonna-
So they better produce the card, or otherwise they don't get the
But
job.
they're not gonna necessarily produce it to the employer, they're gonna produce it to that medical review officer who sees that positive result and then deems it a negative result after seeing that they have that card or that prescription.
So you would have that discussion with the medical review officer, or have guidelines in place around the highly safety sensitiveness of the position. And that medical review officer has to make that decision around, they have to disclose if it's a highly safety sensitive.
So if we
Position.
outsource our pre-employment drug testing, which is what Christine's
Exactly.
talking about.
Very, very
I think
good
what
point.
she's saying is that they're gonna declare that to be a negative test because the person has a card. So we need to have that conversation with them
Exactly.
in our processes.
Our employers need to do due diligence
Okay.
around these highly safety sensitive
Okay,
positions.
thank you.
Absolutely.
Can I just,
Sorry.
just to complicate, just to go off of that
Sure.
scenario, there was the discussion that there's 30 chronic conditions that qualify under the state of Connecticut. Are there short-term applications for it? What I'm saying, if someone has something that requires a 90-day or 120-day recuperation from whatever, that would they would then benefit from the use of this in the short term. Does that, I never, how does that then play into ADA and
Great
special
question.
accommodations?
Great question. So I think that as we engage in the interactive discussion with the employee, we talk about, is there a potential for you to use something else other than medical marijuana? I guess would be my question. And, a doctor's note, description, letter from a doctor should explain that, especially if we're in a position of being concerned about safety. And we have, in the state of Connecticut, we have to have a reason. It can't just be because we don't want it in our workplace. It has to be around safety sensitivity. So, engaging in that discussion is what's really important when we talk about these kinds of chronic conditions and, the use of medical marijuana.
Well, I guess my other thought on that too is if it's a short-term application use, but the card is good for a year, that they could self-medicate, is that?
The card is good for a year because you have to have a bona fide relationship with your doctor to get any medication. I'm the queen of cholesterol, so every year I go in, get all my liver tested, and I get my prescription. I don't get my cholesterol med without seeing my doctor on a yearly basis. Same with this medication. So it's issued on a yearly basis because you have to have that relationship with your doctor. They have to be checking back in with them. It doesn't mean the doctor can terminate the card at any time. He deems you don't need this card anymore, he can call the state and take you off the list. So that would be between you and your doctor, so that could happen if a patient no longer needed the card, didn't want the card, didn't want any of that on their, it would show on their PMP over the last year that they had a card, that they used their medication, but the card can stop at any time.
So I'm gonna simplify this piece let me just add one little quick thing. From an employer standpoint, card or no card, medical marijuana or not, there's impairment in the workplace for many reasons. Every one of you should have a reasonable suspicion practice policy in your organization that says that if I see that you are behaving in a way that you normally don't behave, that I have the right to question you about it and to put my policy into practice, potentially sending you for a drug test. There's really no other way to be proactive about this. That's all I want to say.
Okay. We have a question.
Anything in the works to get an FDA approved for any conditions?
Yes.
Okay.
I mean, and there are 3 products that are FDA approved. 2 are synthetic THC products, Nabilone and Dronabinol, which are used for some of the indications that I mentioned there's evidence supporting. The 3rd one was just approved, I think, the last year, and it's actually from the plant, the first one that's from the plant, and that's cannabidiol for these rare childhood seizures,
So that
Dravet
you can
syndrome.
actually write out a prescription
Yeah.
for with dosage
Yeah.
and everything
Yeah,
else.
and
It just seems odd we have something existing that doctors aren't really prescribing.
some people make the argument, exactly what you're saying, they make the argument, use the FDA approved forms that are available, but the counter argument is, well, we're not saying that it's just a synthetic THC molecule that's helpful. It is a combination of THC, CBD, or it's the entourage effect, the full plant, and so forth, and the terpenes, etc. But that's the argument. But there have been a number of studies that have been done using the FDA-approved products off-label for some of these other indications. There are many other things being studied right now.
So eventually, it may just be something that's FDA approved and there won't be centers where, or, because it seems such a different
Probably not.
kind of medicine than what
Why
we
is
used to
that?
using.
Because there's not going to be, I don't think that is going to be the kind of investment from pharmaceutical companies in a medication that might be sold over the counter at a legal marijuana store. You know what I'm saying?
It's a pharmaceutical company.
Well, would you put the money invest all the money into getting an FDA approval, which costs billions of dollars? If next year we hear from Cathy Abercrombie,
What's the point?
Connecticut might legalize it, which means everyone's gonna say, you know what? Thank you, doc, thank you, dispensary, but I can go down to, Joe's party shop and get whatever I want, right? So it's probably, but the research is still going to be done. And so we'll get the research, we probably won't get all that many more FDA-approved products. That's my thinking. I don't know if you had some thoughts, Mary.
I think you're correct. I mean, it really depends on who's running the government, whether it'll be approved or not, or researched.
Yeah.
I have two questions. Do you have an age limitation for dispensing marijuana when it comes to children in the state of Connecticut?
There's I think a list of 11 disease states where children can a doctor can qualify. In that case, it takes the child's primary care in addition to a board, someone who's in a specialty. It takes 2 doctors to qualify a child into the program.
And it's 18 and above without that qualification.
Yeah.
And my other question, you mentioned that there were 4 ways to, 4 dosage types for marijuana use. One of them was
Administration
the
types.
vaping. And there's a lot of controversy today with vaping. What concerns or issues have come up with medical marijuana being vaped?
Yeah, it's more, what we're seeing with the vaping is the additives that have been added to the products that you're buying in vape shops on the internet, on the black market. They've been adding vitamin E oil to it, which is causing all these problems, or they're using faulty hardware, which have heavy metals and things like that in it. There's a lot of additives, flavorings, things that really don't belong in it when you're in the vape shops and in the black market. The products that we have all have all the labels on the label. There's no vitamin E in any of the products. All the producers in Connecticut list everything on the label. That's been the real issue that's come up lately, is the vitamin E.
And why is that? What's in the vitamin E?
They're cutting an expensive ingredient with something that's cheap, similar viscosity, looks a lot like it.
Vitamin E is toxic to the endothelial layer and so forth.
Yeah, but it looks
It
like,
belongs.
the same oil, so they cut it in half and now they can sell it.
You can eat vitamin E without a problem, but if you inhale it into your lungs, not so good.
Yeah.
Did you have another question? No? Oh.
Do you anticipate an increase in the number of producers in the state?
Growers?
Yeah.
When you say producers, you're
Yeah.
meaning the growers?
Right.
I would say yes,
Growers and
if,
distributors.
I would say, so let me rephrase that. I would say if it becomes legal, yes, I would assume that they would increase that. To date, we have 18 dispensaries. There's 14 that are up and running and 4 that are, should be going into effect within the next 3 months.
So these are not like CVS's, one can't pop up on every corner.
No.
There's like a regulation of how many you
Yes.
can have.
Yes, and they
per
can't be within the pharmacy, and correct me if I'm wrong, cause you probably know it better, so I know what I don't know. My understanding is that the pharmacist can apply to have a license to run one, but it can't be part of their initial building, it has to be a separate building.
It's not in a pharmacy,
Right,
correct.
that's why hers, most people don't know, it's, if you drive by her building, you don't know
The sign
that
is
that's
this big.
what it is.
For a reason.
And it's in a
Right, I
very
see it, yeah.
commercial area,
Another question, with the pilot hemp program, some of the farmers out there that are part of the pilot program says that, they're saying when it's legal in Connecticut, we're gonna be up and running. It sort of sets them up for it. What's the state's goal with the pilot hemp program?
So at this point, the hemp was and these guys probably know better again, because I'm not a pharmacist and I don't play one on
It has to be
TV.
less than 3% THC and
Right.
0.3.
at any point, yeah.
Right, so my understanding is this all came from the feds with the deregulation of the hemp not being a class 1 narcotic, and that's why we're allowed to grow it. The reason why we had to do it, a speed bill on it, for lack of a better word, was because the growing season was, so we're in what, we're in September.
Started in
So it was
June.
like in May, we
Right.
had to do the bill right away because they needed to get the seeds
Right.
in the ground right away to start to grow it.
The seeds
yes,
from
they-
heaven.
The seeds from heaven. So I would, I mean, they would still have to go through the regulation
Right.
process to be able to do another product, if you wanna say, right? Because hemp is not considered marijuana anymore under the new definition. So that would, that would be something that would have to go through the Environment Committee and then also go through general law because it would be regulated under Department of Consumer Protection at that point. If, and this is all around if marijuana, is legalized, recreational, let's say.
We have another question in the back.
This question's for Pam, and I'm from the Employers Association
Oh.
also. So,
Hi, Lisa.
Hi, Pam. So, Pam, what would you say is like the top question around this subject that you're getting on the hotline? That's part one of my question, and part two is, what recommendation do you have for all these employers in this room on what they should be doing now? I know we already have medical in Connecticut, probably gonna have recreational, and in Massachusetts, we already have both.
Yeah,
And
yeah.
we take a lot of calls on our hotline, from Massachusetts employers as well. So could you, like, what kind of questions are you getting most common, and what do you recommend that everyone in this room do as employers, proactively?
Yeah, I mean, I think I've been talking, thank you, Lisa, but I've been talking about it a little bit. I will say that, we do get a lot of calls from the Massachusetts employers as a result of the legalization of recreational marijuana. So, they've showed up to work today, they're, obviously, either they smell like marijuana and I wanna send them home. Well, certainly you can do that, we're all at-will employers, right, you can do that, but what's the lashback around it? Is, do they have a medical marijuana card? Are we engaging in a conversation about why they smell like that? I would say that probably the most proactive thing that we can do, I've said it already, is just have some kind of policy in place that says that we can test for reasonable suspicion if we have it. And train your managers, train your people around what it looks like, put together a policy, communicate it, be proactive about it. Even if they are using medical marijuana, we can still use that policy to kind of test for it and have the jumping off point to have that discussion with people. I mean, people are using medical marijuana for a reason. They have they have a disability most of the time. And under the American with Disabilities Act, it is very broad. Disability, that category, is huge, and as employers, we know that. So have some policies in place that really help guide you and that you can kind of pull out and say, okay, let's have this discussion. Here's how we're gonna deal with this.
And in Massachusetts, under the medical portion, under their state statute, it says employers are not required to provide accommodations allowing employees to use medical marijuana. And then for the legalization of the recreational, it says that the law provides that it does not require an employer to accommodate, again, marijuana use that is otherwise allowed by law. So we said, yep, you can smoke it legally, but we don't have to accommodate you as an employer. And then it also affects the employer's ability to enact and enforce workplace policies restricting employees' marijuana consumption. And I think that's a legitimate concern of the business community. And I think that's the piece that for us in Connecticut, as we've been having this conversation, is really important. And that's a piece that we can't just take for granted and say, well, these are the rules that Massachusetts has. I think here in Connecticut, we would want them to be tighter than that, because we want to be able to support our employers, and to also make sure that the safety of the everyday person out there is protected. So for example, in this room, the drivers of, like David's group hunters, that's a safety issue because they're first responders, right? But it's also a safety concern if somebody from Easter Seals is transporting children, right? So you can't have rules for just the DOT
Right.
around this issue.
Right.
There has to be, in my opinion, strict rules around the safety of the job that you're doing.
And I'll add to that, so, absolutely, and if I haven't said it already, there's under no condition that we have to allow an employee to come, to be impaired at work,
That's right.
marijuana or otherwise.
That's right.
We don't have to allow it on our properties, we don't have to allow it in the parking lot, we don't have to allow it. So we have rights here as employers, but we do have to talk with them if they do have a medical marijuana card about the potential of reasonably accommodating them to be able to be under the influence or test positive for marijuana, okay, around their jobs, and looking at what that accommodation might be. It might be leave, it might be, looking at potentially having somebody else do another part of their job that we think might be concerned or a safety risk. So that is our obligation, is to talk with that employee about their medical marijuana use.
Is medical marijuana treated differently than other intoxicating legal substances?
I would say no, okay, on its face, no. But there, certainly are other challenges, right? When someone comes to work and they're under the influence of alcohol, we probably can smell it. I'll say that's probably the number one thing. A lot of times we don't know, especially with all these different kinds of products, we don't know what the reason is that they're impaired. So we do have to treat it a little differently. We have to be more aware. We have to have a better understanding of what impairment looks like in our employees, which means we have to really know what our employees are like. Bless. How they behave on a regular basis to recognize impairment. So we have more of a responsibility as managers and colleagues to kind of check in with people and really understand, what looks funny, what is behavior that's not normal in our employees.
So what if it does regulate your behavior? Like say there's someone with anxiety and they're taking a ton of Xanax, just to get through the day.
Mhm.
You could sit at your desk and pop a couple Xanax, but you're not gonna be able to sit at your desk and, smoke, vape, medical marijuana.
Right.
But that doesn't impair you, so say it just regulates you. Is that person required to tell their employer that they've changed their prescription from Xanax to medical marijuana?
No, but nobody's
No.
required to disclose that information. The only thing that I would say on that is that, again, the responsibility of the employer is to make sure that the job's getting done, which is why we have to kind of go back and make sure that we really understand what exactly is happening when our people are working. Are they doing the job? Is, our A performer all of a sudden a B or C performer? What's going on? That's really all we can have our arms wrapped around.
If there's no impairment and there's no safety risk, then
Correct.
But it also depends on the disability too, right?
Right.
So depending on the job that you do, so let's take United Technologies for an example, right? So these guys are working on airplanes, right? They're doing the parts of that. In your job application, right, it asks about disabilities, anxiety, which is huge amongst our young people, and we could talk about that for hours. A lot of these young people, you don't have to say that you have anxiety, right, on your application, because it's not considered one of those disabilities. But they're seeing that the CBD helps with anxiety, right? So it goes to your point, what's the difference between that or popping a Xanax?
Exactly. And I'll say that at least those jobs are federally regulated, so we don't have to worry about our planes.
But
people,
they
right?
can't,
For the most part, right,
but the
right.
drug testing is very different.
It is different.
Because they can't do random drug testing under
Exactly.
federal law, which is ridiculous.
Right.
That you can work on my airplane, but I can't drug test you, in my opinion.
But also CBD is not going to be psychoactive, highly unlikely to impair your functioning.
Right.
Fairly benign stuff.
So that's comforting.
But
I guess my thought too is that there's a lot of prescription medications that impair you as well.
Absolutely.
And so it's really, we
Absolutely.
have to be looking at the impairment of the patient. You don't necessarily not want someone on 80 milligrams of OxyContin with some Valium and some other, low flexerol on the side, all written legitimately, filled legitimately, and they're just as impaired, or maybe more impaired,
Right.
Question in the back.
So that's kind of exactly, it's a great bridge to my question and comment. Such a meaningful discussion, and I wonder where we'd be if we had this kind of grassroots, meaningful discussion years ago you know, prior to the painkillers hitting. And certainly we're in the midst of a horrific opioid crisis across the country. Those are federally tested, regulated, implemented pharmaceuticals. And so we're having this very meaningful conversation here. And opposition side of the marijuana argument oftentimes says it's a gateway drug.
Right.
So I have a two-part question. So that part is clinical to Dr. Allen about maybe a brief overview of speaking to that component. And the second part would be really to Cathy. Has the opioid crisis and where we have ended up as a society right now with the tremendous loss of life, the tremendous socioeconomic adverse impacts of that, has that influenced the discussion from a political policy standpoint? Those are my two questions.
Go ahead, Dr.
I'll take the softball. Thank you, David. So looking at marijuana as a gateway drug. Yes, certainly marijuana is one of the gateway drugs. If we're talking about people who are most vulnerable, and let's look at people with not fully developed brains under the age of 24 for males or females. Any addictive substance, part of really the terror of the 80% increase in high school students vaping nicotine products in 2018 is because of the potential down the road for what an addictive substance does to a developing brain, and it primes the brain for all addictions. So it's that kid who is using nicotine or alcohol or marijuana when they're 15, 16 years of age who becomes addicted to opioids when they're 24, 25, 26, and overdoses and dies. And, you know, the ambulance goes out and hopefully revives them and brings them in when they're 28, 29 years old. But they've been primed. So, you know, is it marijuana? Yeah, it's marijuana. It's alcohol more frequently. It is nicotine. It's nicotine. You know, it's any addictive substance. The same part of the brain gets primed if you are under the age of 24. But, you know, if you really want to focus in, 90% of adults with substance use disorder started using an addictive substance, including cigarettes, before the age of 18, 96% before the age of 21, and then your other 4% probably before you're 24, 25. And so, great question. Thank you. I'm glad you read the note I gave you.
So, I would never disagree with Dr. Allen, but I do disagree a little bit with him. Let me just say that. Gotta have the other side of the coin. You know, I said at the beginning, right, as a mom of 3 sons, old school when it comes to it. I don't believe it's the gateway. I believe that, you know, there's people that have addictive personalities that, yes, this will impact them differently, but I don't believe by legalizing marijuana that it will be the gateway drug to other drugs. There are going to be some, but overall I don't believe that. I believe that the opioid crisis, right, there's a lot of people we can blame for that. We can blame the pharmacies, right, the pharmaceutical companies, right, for coming up with this. We can blame the docs. You know, I always use as an example, when my oldest had to have his wisdom teeth out, right, at age 19, they weren't impacted, so they did it in the doctor's office, right? Goes in, has 2 out, because they're already out, and doc gives me a prescription for Percocet, right?
My 14-year-old's dentist did the same thing, 3 years ago.
18 pills, right? I look at him and I said, you do realize this is a 19-year-old kid. Just take it and fill it. You don't have to give it to him, right? So I say to my son when we get in the car, only because of with my job, I knew what was going on back then, right? But most parents don't, right, understand these drugs. So when we got in the car, I said to him, yeah, we're going to try some Tylenol and we're going to see where it goes. And if you're in a lot of pain, definitely, I don't want you to suffer. Never had to fill the prescription. Fast forward, he has to have the other 2 teeth out. Go back to the same doctor, takes them out, goes to give me the script. I said, nope, I'm not taking it. You know, he didn't need it with the first 2, he'll be fine with the next 2. Oh, but you really need to take it. right? Yeah, right, now this is going back, cause he's 32 now, so this is going back over 10 years. But, you know, the opioid issue, there's a lot of people, and there's also the insurance companies, right? How many of us now could do with 5 pills, but the insurance company says that you gotta have 10 or 15 of them. So I think that as we look at the opioid addiction, right, we're also, I think it's part of the conversation, but I don't believe that it's a main part of the conversation when it comes to the legalized marijuana, and at least for me, you know.
So we have time for just one more quick one, and then we have to close. Go ahead.
Dr. Allen mentioned that 9% of medical schools are educating physicians on the subject matter. What about pharmacy schools?
There's programs. UConn, St. Joe's, they all have programs now. It's included in the program.
So is there, with it being new, is there, if you are already a pharmacist, do you then have to go back and take coursework or study?
Right, I don't have a certificate, or there is no certificate. Now it's included in the program. I had to go out there and get it all myself. Started in 2014, 2013 or so, but I had to go to researchers, I had to go to seminars, I go to all over the country to different conferences to get the information, make the contacts.
So it's typically part of the curriculum then of the
It is now.
pharmacy schools?
Yeah, I'm too old for that.
Which I think is fantastic, but what I heard you say is that there's no certification required on the doctor's side.
Correct.
And they're just, right, so then how do we
Well,
fix
as
the,
they
how
do
do you
for
do the
oxy.
gap?
And I go a step,
Certified.
I go a step further,
Right.
and
There's a gap.
if the onus has been put on the pharmacist
Right.
who is working within a dispensary rather than on the physician, and who is going to get the training and who is going to do the screening for highly vulnerable patients or for people who have developed a substance use disorder when they've taken this product, and that's not mandated.
Well, the
anywhere
doctor
along the
does
lines.
have a place where they put the recommendations on the website, and we get a copy of that, and I read it to the patient and make them sign it. If the doctor's put a recommendations, no THC, no edibles, nothing. They certainly have
So
an option.
the ones that have had the training and actually put
Right.
something on there that makes sense.
I have patients that show up with directions, and the doctor's told them which products they're buying and what are the directions.
I know.
There are
I'm
doctors
sure
that
Andrew
do that.
Salmer did that, and Jonathan Claus
No,
did that.
there's quite a few
There
that
are
do.
states,
Right.
there are states that mandate training
That's great.
for docs to
Right.
write out these certificates.
Like New York State does.
Mhm.
I actually went through their training because we didn't have one in Connecticut. So I've done all the physician training in New York State because was something I found available to learn. You know, so there are some good programs out there, but yes,
Yeah.
doctors were trained how to prescribe oxy and Percocet and Simvastatin and Lipitor, all those other things, and not on this. But many of the doctors that are working in this field who are certified on a regular basis are making it their job to know what's going on. Not all, but there's good and bad in every profession.
Absolutely.
I think that was a good note to end on. I'm gonna turn this back over to Rosie. I'd like to thank all of our panelists and all of
Thank
you
you,
for
you did
coming
a great
today.
job.
And,